Well, this month is Breast Cancer Awareness Month. So today, for Wellness Wednesday, we are doing exactly that, raising awareness for a disease that affects so many people and their families. This afternoon, we have Mercy Dr. Kiva Bland here with us. Dr. Bland, thanks so much for joining us.
Thank you for having me.
So I guess first, can you just tell us a little bit about who you are and what role you play in someone's diagnosis?
Okay, so I am from Detroit, born and raised, but have family here in Toledo. I am a breast surgeon, been practicing for the last 15 years. My role in taking care of people who have breast cancer is, of course, to take care of the surgical portion of it. The majority of people who have breast cancer do require surgery. That's a part of it. The medical part of it is also very important, but it's all along with radiation and other medications that I participate with the care of the patient.
So you come in after they've already gotten their diagnosis and you help them from there?
Sometimes they come to me before they have a diagnosis. So they may have breast pain, nipple discharge, breast complaints of any sort. They may feel a mass, and so they may come to me or be referred to me by their physician. In any case, we come together and we try to find out what's going on. We get imaging such as mammograms, ultrasounds, MRIs, and if something looks abnormal, then the radiologist will recommend a biopsy. And if that biopsy turns out to be cancer, either I'm involved with them already or they get referred to me for me to further help them with their management.
I want to backtrack just a minute. How
Sure.
did you decide that this is what you wanted to do?
I'll make the story short, but when I was in residency, one of the things that struck me about breast cancer management was that you had a lot of wins. Even though there are some people who lose their battle with breast cancer, you're able to participate in that process even if they do lose. And so I wanted to be a part of that. I wanted to empower women to feel like if they had a cancer diagnosis, that all was not lost and that there were some options that they had. And so what I felt my job was and what I've been able to do is to let people know what's available for treatment, to let them know that things are improving, even in a short period of time with medications and with radiation, those type of things. And they're able to really get good outcomes with breast cancer management.
And we know for a woman, checking often and catching it early
Yes.
is the most important when it comes to breast cancer. So what are some of these signs and symptoms that we need to look out for?
Okay, so one of the things that people should always do, I recommend, along with other professionals in the breast care field, is that women should do self-breast exams or at least get clinical breast exam. And if something feels wrong, does not feel okay, please get that checked out. Be afraid of what you don't find, that you don't manage, versus what you will find and have to manage, because it can become something that's out of control. But most of the time, less than 20% of people who get biopsies end up having cancer. So it's a matter of just finding out what's going on.
For you, do you have more people who end up finding out, when they go and get their appointment, or is it from self-checks?
The majority of people, thankfully, get theirs found when they get their screening mammogram, their annual mammogram that women should start when they're age 40 or sooner every year, up until they just don't feel like they have the health to take care of it. And so most of the time we want to find it when we can't feel it. We want to find it when it's just calcifications. Calcifications looks like powder on the mammograms, and get that checked out. And so that's when we want to find it.
And at Mercy, there is a mobile mammogram
Yes.
that we've talked about on our show before, but let's talk a little bit about it more and the importance of being able to have it go on the go and come to people where they are.
Right. So one of the things that's important about detecting breast cancer early is access. And so even though there's established imaging centers for people to be able to go to, some people are not able to get to those areas, so that they can get to it. So the mobile mammography van is important because it's a way that people can get their imaging with it kind of coming to them. And these mammograms can be set up by appointment, so they can dial 1-833-MAMM-VAN, MAMMVAN, or they can go through the website to try to get an appointment. And then just make sure their insurance covers it, and if they don't, there may be some options available for them, and they just need to reach out to find out what those options are for payment for that.
As a doctor who plays a role in this entire process, how important has this MAM van been for your patients and for the community?
So I do have some patients, actually I just saw one a few days ago, who goes to the MAM van. And even though I'm new to the system, I have seen the impact both in this and in other facilities that I've been in. It really makes a difference because access is the most important for everything. Any type of cancer that you're dealing with, any type of health issue that you're dealing with, access is important. And if you cannot get to it, if it cannot come to you, you will not be able to benefit from early access and early detection.
Yeah.
And so it makes a huge difference.
Yeah, Dr. Bland, I absolutely agree with you. Thank you so much for being here today.
Thank you for having me.
As Dr. Bland mentioned, obviously we have those dates right there for the Mercy Health mobile MAM van. You can sign up online or make that call right there. Thank you again for joining us.
Thank you.